Okay, here is a little crash course on the respiratory system. This is by me, John Rice. Okay, so what is the respiratory system? The respiratory system is essentially just a network of different organs that all work together to help transport oxygen to your organs and allow your organs to actually function because your organs need oxygen in order to function. And it does this through getting the oxygen through the air, which is then carried by your red blood cells. It also does things such as clean waste gas, such as carbon dioxide, so it removes that from your body because that is a waste and your body does not need it. Um, Organs, there are 15 different organs with their own unique functions. These organs are things such as the mouth, the nose, sinuses, trachea, lungs, diaphragm, capillaries, epiglottis, etc. And we're going to cover each one of those on the upcoming slides. So we're going to start with the mouth and the nose. It just serves as openings that allow you to pull air in from outside of your body into your respiratory system. This picture is showing it coming out of the body. It can come out of two ways, but it can also go in those ways. Um, so yeah, and then your sinuses, which are hollow areas between your bones, or between the bones in your head, that help regulate the temperature and humidity of the air you inhale. These include your maxillary sinuses, your ethmoid sinuses, your sphenoid sinuses, and your frontal sinuses. And here are the locations of each. Okay, your pharynx. It's a tube that helps deliver air from your mouth and nose to the trachea, your windpipe. It's also known as your throat, and it's made up of three parts: the nasopharynx, the oropharynx, and the laryngopharynx. Hope I pronounced that right. Here's your trachea. Trachea is a passage connecting your throat and lungs. This is just the anatomy of the trachea, as it says here. It's kind of blurry, so you can't really see things, but just the main shape of it and everything is what you need to focus on right here. So yeah, your bronchial tubes. These are tubes at the bottom of your windpipe that connects to each lung, and here you can see them. This is what your bronchial tubes will look like with asthma, and this is what they would look like normally. As you can see, this restricts airflow, makes it harder to breathe, whereas this is much more open, much easier to breathe. Okay, obviously you have your lungs. It's the biggest organ within this system. And as it says here, there are two organs because there's two. You have your left and your right lung that help remove oxygen, or help remove oxygen from the air and pass it into your blood, and also help you exhale carbon dioxide. Your diaphragm, it's a muscle that helps your lungs pull air in and push it out. It's shaped like a parachute. It's really, really easy to see, and it's kind of right underneath them, like if that makes sense, like right underneath your lungs, that area. Okay, and your alveoli. They're tiny air sacs in the lungs where the exchange of oxygen and carbon dioxide actually takes place. And here within this little picture, we get to see what they look like up close in a little cartoon, and it kind of explains that they're the important of the respiratory system and that the exchange from carbon dioxide in the bloodstream occurs here. Carbon dioxide and oxygen in the bloodstream occurs here. Okay, your bronchioles. They're small branches of the bronchial tubes that lead to the alveoli. So as what was just discussed, your capillaries, these are blood vessels. They're not only in the alveoli walls, they're everywhere, but in this case we're talking about the respiratory system, so they're blood vessels in the alveoli walls that move oxygen and carbon dioxide. So this is basically how your red blood cells are able to move around your body. You have your lung lobes. These are your sections of your lungs. There are 3 lobes in the right and 2 in the left. Here you can see them. You have the inferior lower lobe right here in the left lung, and you have the superior upper lobe, again in the left lung, superior upper lobe in the right lung, middle lobe in the right lung, and inferior lower lobe in the right lung. The pleura, thin sacs that surround each lung lobe and separate your lungs from the chest wall. There's not much more to say about it because pretty implied. The cilia, these are tiny hairs that move in a wave-like motion to filter dust and other irritants out of your airway. Here's a picture of them. They literally look like hair. They're very small, and there's millions of them. Your epiglottis. Your epiglottis is a tissue flap at the entrance of the trachea that closes whenever you swallow to keep food from entering well, to keep food and liquids from entering your lungs and things like that. Um, Whenever you say you swallow wrong, um, it's just your epiglottis didn't close in time to prevent. Most of the time it's liquids, but prevent a liquid from going into your lungs, and that's why you start coughing, because you're trying to get that liquid out of your lungs, because it's not supposed to be there. Your larynx. This is a hollow organ that allows you to talk. This is literally your voice box. So how I'm able to speak to you right now? I'm able to speak to you right now because of my larynx. It's located kind of towards the bottom of your throat. And here's a diagram of everything. Um, you can see all the things that we discussed earlier, like your sphenoidal sinuses. I mentioned those, frontal sinuses, um, left and right lung, etc. I'm going to leave this here for a second in case you need to see it. Okay, and then respiratory diseases. There are many respiratory diseases, but the two that we're going to discuss here are lung cancer and COPD. Lung cancer is basically abnormal cells that occur in one or both lungs, and they can't carry out the functions of normal lung cells, and they will never be able to develop into healthy lung cells. The main causes of lung cancer are smoking tobacco, because it can mutate your cells in your lungs and kill them, and yeah, don't smoke, it's not good. Some major signs that you may have lung cancer are a cough that does not go away, or a cough that gets worse over time, coughing up blood, chest pain that is often worse with deep breathing, coughing, or laughing, a hoarseness, a loss of appetite, an unexplained weight loss. The unexplained weight loss is very common with all kinds of cancer, a shortness of breath, or a constant feeling of being tired or weak, or just that pertains back into the shortness of breath, just out of breath. Some ways that it are diagnosed are chest x-rays, CT scans of your chest, or lab tests on a tissue sample removed from your chest by a CT-guided lung biopsy. Treatment for lung cancer mainly includes chemotherapy, as do many other cancers. And then respiratory diseases, COPD. COPD stands for chronic obstructive pulmonary disease. It is a group of lung diseases that block airflow and make it difficult to breathe. Causes of this would be long exposure to lung irritants, such as, again, cigarette smoke. Most lung diseases most permanent lung diseases or deadly lung diseases, aside from like bronchitis, pneumonia, things like that, are results of tobacco use or smoking. These are just two of the most prominent ones. Some major signs that you may have COPD are shortness of breath, especially during physical activities, wheezing, chest tightness, a chronic pain that may produce mucus, that may be clear, white, yellowish, or greenish, frequent respiratory infections, a lack of energy, or an unintended weight loss, but that occurs in the later stages of COPD. Diagnosis for COPD is diagnosed through spirometry, which is, according to the internet, a common office test used to assess how well your lungs are working by measuring how much air you inhale and how much you exhale, and how quickly you exhale. And as of now, October 26th, 2020, there is no treatment for COPD as of now. But there potentially could be one in the future. Who knows? Just kind of depends on